Namaskar, Salam, Sat Sri Akal, and good evening to you all. I welcome you all yet again in our next session of DIH. I welcome you all from the dreams because we are celebrating today 26 years of dreams. Dreams यानी सपने, और ये वो सपने नहीं है जो हमें सोते हुए आते हैं, ये वो सपने थे जो हमको सोने नहीं देते। सपना एक ऐसे समाज का, एक बेहतर समाज का, ये सोचकर कि आज चल के तुझे मैं लेके चलूं एक ऐसे गगन के तले जहां गम भी ना हो, आंसू भी ना हो, बस प्यार ही प्यार पले। तो actually, dreams is an abbreviation of dynamic, revolutionary, egalitarian, assergent, motivative society. It's a consortium of professionals like doctors, engineers, journalists, artists, and people from general public. These all joined hands to work for poor, downtrodden, destitute, and sick without access to modern amenities. We wanted to make the society happier and healthier. Doctors in our team were particularly more active, I will say. I'll just share the screen. Yes. So we started our ordeal with camps in the Muhammadpur and Ramzanpur villages, where the nearest medical facility was 22 kilometers. There we started doing camps. We did mega camps where this is the mayor of Delhi and eldermen and all specialist doctors. It was a mega camp with thousands of people attended, and it was very much appreciated. People from youngest group to the oldest group, all enjoyed it, all appreciated it, and all participated it. And there were specialists from all fields: orthopedic, there were specialists, eye specialists, dentists, or general public, every gynecologist, they were all there. Then later we adopted a village, Hirapur, where we used to go regularly and give medicine. We started a tuberculosis detection program, but later on we covered all the diseases because there also there were no chemist shop, there were no near pathologists, and nearest facilities were quite far off. So we used to go there regularly. And then we did several other camps like diabetes, like alcohol de-addiction, so many camps. But what got the spotlight was the earthquake side. We went Bhuj mein jo earthquake aaya tha 2001 mein, that caught the light. We went there, we did our services in the deepest of areas. बहुत सारे, we did minor surgeries also, dressings, and it was all over in newspaper, so many newspaper at that time. So we caught light there. Later we started e-magazine. This e-magazine was more than 3,000 circulation. It's an international magazine, very well appreciated. Then in 2019, DIH was born. So DIH is the offshoot of Dreams, which was dedicated specifically to homeopathy. With the policy of no criticism, no politics, embrace all, we tend to take the torch of homeopathy ever higher. We feel that woods are lovely, dark, and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I speak. The USP of newness and DIH is warm heart to all and desire to ever learn. कहते हैं ना कि सफर का एक सिलसिला बनाना है, अब आसमां तलक रास्ता बनाना है. And anybody with similar emotions, can you see the screen? Is the screen visible?
Yes, ma'am. Yes, ma'am. Visible.
Yes, ma'am. It's visible.
So with DIH, we started, it was specifically dedicated towards homeopathy, and we wanted to give awareness to all. So we started CMEs, awareness to local people, awareness to fellow doctors of other systems, and to laymen, for everyone. So we started doing CMEs. This was our first session where Dreams e-magazine's 75th issue was inaugurated. We did different CMEs. This was a CME on immune disorders. We did CME on malignancy. We did CMEs on infertility and stress. We did CME on therapeutic methods. And the full halls actually showed how much we were appreciated. Then the game of COVID came and there was, everything was stopped. सब कुछ खत्म, रुक गया था जैसे. उसके बाद हमने कैंप्स करे जहां पे हमने कोविड के लिए दवाइयां बांटी. So these are the camps where we distributed medicines, maintaining the COVID protocols. We did camp with DIH and DAI also. And then started the era of webinars. We did webinars, several webinars on COVID, on scalp disorders, on skin issues, and we did webinars on veterinary disorders, which was very much appreciated. And this is my team of DIH. Very hardworking, very responsible, and tremendous team. And I really love all my teammates because we feel वो धूप के छप्पर हो या छांव की दीवारें, अब जो भी उठाएंगे मिलजुल के उठाएंगे. The point is, when I'm talking of my team, I must take the name of one particular person, Dr. Pooja Kapoor. She was our teammate, and the thing that I remember by taking her name is, कितने मंजर उसको देख नहीं पाए, एक मुसाफिर कितनी जल्दी लौट गया. I request Dr. Preeti to please come and say a few words about Pooja. Dr. Preeti?
Yes. Yes, good evening, ma'am.
Good evening, everyone.
Good evening, everyone, and thank you, ma'am. Thank you for keeping this special session for our beloved friend Pooja. This is a presentation which I wanted to share. This is the presentation. These are some photographs of memories of our beloved Pooja. I hope you all remember her.
Very much, always.
Yes, ma'am. Of course. So as rightly said by ma'am, the Pooja Kapoor, a member of DIH family, she was in my batchmate and a very unique personality. Needs no introduction. As you all know her, she was a very strong personality and we all have our own special memories of her in our heart. It is very hard for me to speak today, having spent the happiest time with her in the college and afterwards, discussing work and knowledge. She was such a strong person through and through, from her character, personality, and her presence. She studied in Dr. B.R. Sur Homeopathic Medical College to become a doctor and does a private practice in Delhi. But she was so eager for the knowledge that she joined many organizations like HCI, DIH, etc. for being a successful doctor. Her unique ways of remembering the drugs, homeopathic drugs, was the first point of attraction for me towards her in the college time. But later, as we got together, her knowledge, her choice, her humor made us friends. She used to find humor in all the ways and things. And she was very light-hearted and a very caring personality. She was very actively working with many organizations on also looking after her career as well. Every one of us will have the private memories of her as she touched many of us. And we are all going to cherish it for all and keep it close to her heart. Her spiritual power, her positivity kept her going in spite of her suffering from last few years. It was a very difficult time for her and her family also, as her health was deteriorating. But in spite of that, she fought well. She fought with her cancer. She fought with everything which is keeping her back and to keep her going. But we were all lucky. I feel we were all lucky to have her in our life. And she will always remain with us, and we will always going to miss her. Although we cannot see her now, but her memories will always be with in her heart will be always there. We will keep you alive in your beautiful memories always. That will be our guiding spirit. Thank you, Pooja. We will miss you always. Thank you.
True. Soft-spoken, caring, kind, sincere, and very much lovable. ऐसे वो फिराक हो या विशाल हो, तेरी याद में है कि एक दिन वो गुलाब बन के खिलेगा क्या जो चिराग बन के जलाना हो. She'll always remain in our heart. She'll always remain around us, and she always used to say she wanted to do so much for the EIH.
Yes, ma'am. She was very enthusiastic.
Very enthusiastic. We will fulfill her desire. Definitely, we'll take the torch of DIH higher.
Thank you so much, ma'am.
We have also lost. Thank you, Preeti. We have lost one more active member of Dreams, Dr. Ilandrian. He was a regular in his article for Dreams magazine, a very honorable person. I respect him a lot. He even gifted so many books for the purpose of magazine. I will request her daughter, Jhansi, to say a few words about him. Jhansi, please join in.
Fine, ma'am. Thank you. A very pleasant good evening to another present here. I'm very happy to see all your clippings, whatever you have done so far in your dream, and really appreciate. So I haven't seen such a kind of activities so far done in the field of homeopathy. It's a selfless service which you have been doing all these days, and I'm very happy, and I feel very regret to say about my dad. Dr. A. Ilandrian. He was born on April 20th, 1950 in a small remote village called Ernamangalam in Tirunamala district. That's in Tamil Nadu. Can I share the clippings of my dad?
Sure.
Fine, ma'am.
We can't see your clipping.
Yes,
we can't hear you.
You can't see my. Wait, please.
No,
Is it visible for you, ma'am? when
Yes,
Dr.
ma'am, we can
Lin
see his
was,
photo.
was born on April 20th, 1950 in a village called Ernamangalam. It's in the Tirunamala district of Tamil Nadu. He was the eldest of 4 children of his parents, Annamalai and Shivagami Amman. At the age of 25, he got married to V. Kaniga, a teacher, my mother. And he was blessed with 3 daughters. I am the eldest one. He started his career as a civil engineer, and done a lot of civil works in Salem steel plant and in other regions of Tamil Nadu, like Trichy.
We can't hear. Jansi,
Like,
you're not audible.
yes, ma'am. Yes, ma'am.
Right.
Hope it's audible for you right now.
Yeah, right.
Yes,
Okay.
extremely sorry. He started his career as a civil engineer, and then lot of civil works in Salem steel plant and other part of Tamil Nadu, like Trichy, Chennai, and Tiruvallur. And as he was fond of and he came to know the value of homeopathy, he started to qualify himself, and he had done a DI home in Marvel Homeo Mission and MD in British Council. His ultimate aim was not to serve, his ultimate aim was not to earn money, to serve the people. And he has contributed himself, and he has dedicated his life at maximum time in learning and preaching homeopathy. He continued his service as a secretary of Salem Taluk Homeo Association, and he organized various free medical camps and conducted variety of classes in various places of Salem district and also in other districts also. Later on, he became the secretary of Salem District Association. Have posted some of the pics of my father, where in every year in Dr. Hanima's birthday, he used to organize a seminar. He learned ROH, Revolution of Homeopathy, from his mentor, Dr. S.P. Victor, and he started practicing the same. And he owned 3 clinics in Salem district, and also he had been a visiting doctor in various parts of Tamil Nadu. In 2011, he founded a trust in the name of Happy Life Foundation. Through the trust, every year he organized state-level seminar during Dr. Hanima's birthday, and he published the souvenir, whatever the doctors presented during the seminar. Since 2011, he was publishing a Tamil Homeo quarterly magazine named Jnana Maruthuvam, and it has been circulated till last month. He had written more than 100 articles in various magazines in Tamil Nadu, and he had written few articles in English magazines also. He gave lectures in many seminars and public meetings to create awareness on homeopathy. He always carried a medicine kit with him wherever he went, and he treated the patient voluntarily with enthusiastically. He had published 2 books named Alagum Arogyam and 1 book in English called Indication of Delusion Singular. He had been teaching in a new way of homeopathy that is based on mind symptom, the mental state. He had taught many doctors throughout Tamil Nadu. Even for the past 1.5 years after the COVID, he had been organizing webinars with experts in medical field. He taught many things over the years, but most importantly, he taught how to be a good human. He staunchly believed in Hindu culture and spirituality, that only with the blessings of God he would cure the patient. He was sincere, dedicated in his teaching. He is an ardent follower of a single remedy, and never in his life he recommended or he prescribed a patent at any cost. Sometimes he followed his intuition and said some of his patients can't be cured. If his mind says only, he would take up the patient. He never go back to money, beyond the money. He never craved for money. He devoted most of his time in spreading homeopathy by and large. He was worshipped like a living God by his family members. In spite of all his work, he never abandoned his family and his responsibilities. He was a dutiful, affectionate father and a grandfather to our children. He was like a banyan tree to all of us. He never been bedridden, but we lost him on 6th January 2022. About 15 minutes after, he sent a message in his homeopathic group. Till his last breath, he had been treating his patient 1 hour before his death. He's a karma yogi. He'll be greatly missed by every one of us who have been in touch with him. We really missed him, but we pray his soul to be in rest. And I thank Dr. Anupam and other crew of this dream for giving me chance to express the feeling of us and about our father. And thank you everyone for listening to this. Thank you everyone. Thank you, ma'am.
Thank you, Jhansi. Thank you so much. It was an honor to be associated with a person like that. The book Mind Singular he had gifted me, and it was a regular feature of our magazine. People also appreciated it, and they told that it is effective. The medicines referred in his book were really effective. I got letters for that. Let us keep a 1 minute silence for both our members. We pray for their ultimate peace.
Thank you, ma'am.
But life has to go on. यही जीवन है, यही जीवन है, यही जीवन का रंग रूप है. Life has to go on. We have to move on. So let us move further to our program. We know COVID has made the mess of life for everyone. मगर कुछ लोग ऐसे भी हैं जो इस कठिन समय में जिन्होंने बहुत काम किया और बहुत लोगों को उठाया. ऐसा कहते हैं ना कि चढ़ता है नजरों में शख्स तो बस अपने किरदार से, यूं ही किसी इंसान की इज्जत नहीं होती. So there are people from general public, from doctors as well as laymen who have worked a lot in these hard times to help the suffering humanity. We want to honor few such people. Since it is our 26th anniversary, we will be honoring 26 people. 8 people we are honoring this time, and every next month onwards we will be honoring 2 more people every month. So I will name the first person, Captain Manoj Loomba. Captain Manoj Loomba, please आप सामने आइए. इनके लिए मैं ये कहना चाहूंगी, उठो तो ऐसे उठो कि फख्र हो बुलंदी को. उठो तो ऐसे उठो कि फख्र हो बुलंदी को. झुको तो ऐसे झुको, बंदगी भी नाज करे. Captain Manoj Loomba is an ex-marine captain who had worked at sea for more than 17 years and now doing legal work in Delhi. He has been actively conducting He has actively conducted 16 camps for COVID vaccination since March 2021. Till now, he has vaccinated more than 8,700 people. Basically, he is a philanthropic person at the core of his heart. You name a problem and he is there to help. हर तरह से सोसाइटी के हर को, इवन एनिमल्स के लिए उनके दिल में इतना प्यार है, वो किसी को मुश्किल में देख ही नहीं सकते. मनोज जी, आप प्लीज सामने आए.
नमस्कार मैम.
मैं आपसे चाहूंगी कि आप कुछ अपने एक्सपीरियंस शेयर करें.
गुड इवनिंग लेडीज एंड जेंटलमैन. मेरा नाम कैप्टन मनोज है. थैंक यू वेरी मच डॉक्टर मैम, अनुपम जी and all the DIH for recognition. मैम मैं तो यही कहूँगा कि मैं तो अकेला चला था अपनी मंजिल पर, लोग जुड़ते रहे और कारवां बनता रहा. तो धीरे धीरे करके we started doing this camps with only 2 people, and now with the help of the government, PK hospital and some of our group people. So we have now vaccinated more than 8,700 people, as you said, ma'am. And now we have started giving the booster dose to all the people. तो कोशिश करेंगे मैम जितने ज़्यादा हो सके और India become COVID free as soon as possible, and then we can start working abroad to assist people as well. So thank you for recognition, ma'am. Thank you very much. God bless, ma'am.
थैंक यू मनोज जी. ये सर्टिफिकेट हम आपको अभी वर्चुअली प्रेजेंट करना चाह रहे हैं. एज द थिंग्स बिकम ऑफलाइन, वी बी मीट फिजिकली, मे बी वी विल बी एबल टू ऑनर यू फिजिकली आल्सो.
जी जरूर मैम. थैंक यू वेरी मच मैम. थैंक यू.
अब मैं नाम लेना चाहूंगी मिसेस सुविधा चौधरी का. कहते हैं हुकूमत बाजुओं के दौर पर तो कोई भी कर ले, हुकूमत बाजुओं के जोर पर तो कोई भी कर ले, जो सबके दिल पे छा जाए उसे इंसान कहते हैं. सुविधा जी आप सामने आइए. बहुत डेलिकेट सी दिखने वाली, बहुत प्यारी सी, बहुत मासूम सी दिखने वाली सुविधा जी ने कोविड के टाइम पे इतना काम किया है. सुविधा जी आप सामने हैं. सुविधा जी ने इतना काम किया है, प्रोएक्टिवली, सोशली प्रोएक्टिव. बहुत काम किया इन्होंने, भाग के लोगों को प्रिवेंटिव मेडिसिन, और जहां इनको मुश्किल लगती थी वहां इन्होंने पेशेंट्स के लिए बहुत काम किया है. तो सुविधा जी मैं चाहूंगी कि आप अपना कुछ एक्सपीरियंस शेयर करें.
Thank you so much, Dr. Anupam ji. It is when you do good yourself is when you see good in others. So I really believe that, and I learn a lot from you every single day. I'm honestly speaking, I'm a simple housewife. I just helped. I didn't even think of this thing as a help. I mean, it was all on humanitarian ground. So very simply, that was it. I feel as a human being, we should just help our fellow humans. And I'm sitting at a platform with such high-level doctors and people who have such high thinking and amazing human values. I'm a small dot in the ocean, and just the tip of the iceberg, not a patch on anything that you've done, Dr. Anupam ji. So thank you very much for inspiring us every single day. Thank you really from the bottom of my heart. And I've always been a very firm believer of homeopathy. I'm not from Delhi. Now, of course, I've been here for a number of years, but I've always looked for somebody like a doctor who is not only your doctor, but understands your right pulse. So when I found Dr. Anupam ji, I think that was it. So for me, a doctor is very important to touch your heart and soul, and who actually understands what you do. Absolutely. So thank you so much. I'm really indebted for this big honor. And I hope I can follow a little bit also of what you do. So thank you so much, Ji. Thank you very much.
Thank you, Sudha ji. We are virtually giving you this certificate at the moment, and we will be able to, hopefully we will be able to do it physically also in near future.
Thank you so much, Ji. Thank you. I'm very indebted. Thank you.
I name Miss Lovely Gupta. कुछ ऐसा करो कि मिसाल बन जाओ जमाने के लिए, कुछ ऐसा करो कि मिसाल बन जाओ जमाने के लिए, यूं तो बहुत भीड़ है जमीन पर किरदार निभाने के लिए. So I named Lovely Gupta from Anukulan. She has worked a lot for the people suffering humanity once again. Beside awareness on COVID appropriate behavior, she has been actively involved for relief supplies by providing essentials like dry ration, ready food, masks, sanitizers to underprivileged migrant laborers in Delhi and hungry people, homeless people who lost their jobs. So this is really hats off to her work, really hats off to work. Because she's hello, lovely.
Yeah, hi, ma'am, and good evening, everyone.
Good evening.
So thank you for so much of appreciation. But I think everybody of us has done our bit, in those times, because that was the need of our.
Yeah.
So
please share your few experiences, ma'am.
So our experience was, we were sitting at home actually because we are an NGO who are more into education, and we are associated with Delhi Police, Anganwadis, and we collect urban surplus and distribute it in slums. So, but this picture was like, everybody was struggling because the lockdown was sudden. So migrant laborers, people on streets, they were actually suffering, and suffering was most because of food, not anything else. So we first were doing it individually. And then we collaborated with the district magistrate office, and we were getting leads from them. We visited homes to distribute rations and, ready-made food, masks, and everything. So that was actually a need of our, and everybody was doing his or her bit. So, and we quite liked doing what we did because, we were happy that we were able to help some people who were in actual need of it, because unemployment was there, people were without money. So actually, the first lockdown was very, very severe for everybody.
Thank you, lovely. Thank you so much for
much,
joining here, for helping the suffering. आपने दिल को छू लिया हमारे, और हम आपको ये ऑनर वो भी वर्चुअली दे रहे हैं. उम्मीद करते हैं कि आपसे जल्दी मिलेंगे हम.
Thank you, ma'am. Thanks to you. Thank you.
ऐसा मैं यही सोचती हूँ कि थैंक यू. कोविड में बहुत खराब समय देखे हैं, बहुत खराब देखा है हमने, लेकिन कोविड में एक चीज बहुत अच्छी देखी कि हमने लोगों की अच्छाई सामने आते हुए देखी. हमने लोगों के अंदर में छुपी हुई अच्छाइयां भी बाहर आते हुए देखी. बहुत लोगों ने बहुत लोगों को हेल्प किया, जितना जो कोई कर सकता था उन्होंने किया है. एंड इट बिकम्स आवर ड्यूटी टू ऑनर सच पीपल. अगर हम अब उन लोगों को ऑनर करते हैं, उनको अप्रिशिएट करते हैं, वी कैन, आई थिंक वी कैन एनहांस सच काइंड ऑफ ह्यूमनिस्टिक अप्रोच.
कहते हैं ना, वो लोग डॉक्टर्स के पास हमेशा जाते हैं देखने के लिए, ब्लड प्रेशर तो नहीं कम हो रहा, ये तो कम नहीं हो रहा, ये बढ़ा नहीं, ये नहीं देख रहा कोई कि इंसानियत कम हो रही है, उसको भी बढ़ाना है अभी,
उसको बढ़ाना है. हम उसी को एनकरेज करना चाहते हैं. यही हमारा पर्पस है, हमारी ड्रीम्स का पर्पस यही था, बेहतर और खुशहाल समाज बनाना. यही हमारा पर्पस था.
Thank you, ma'am.
Thank you so much. Thank you, everybody. And I think now we should continue with the educational session, जो हमारा webinar जो हमारा आज का है. I will invite Dr. Arvinder to please introduce the speaker of the day.
Good evening, everyone. On behalf of Dreams and DIH, I'm Dr. Arvinder on this side. I hope I'm audible to everybody.
Yes, yes, very much audible.
I would like to introduce Dr. Sadath. Dr. Sadath is practicing homeopathy from 27 years in Kochi. He is a well-known personality in the field of homeopathy. He doesn't need any introduction on it. He is currently State Committee Member, Qualified Private Homeopathic Association of Kerala. He's taking today's webinar, and he will be guiding us towards COVID and role of homeopathy and treatment of homeopathy for COVID patients and complications. Over to you, sir. The podium is all yours. So please unmute yourself. You're on mute.
Now, okay?
Perfect, sir.
Okay, thank you. Anupam, I know Dr. Anupam since long, maybe around 7-8 years. Dreams. This is my first involvement with the Dreams. And Anupam, I never knew you have done so much. Even though we know each other since 7-8 years, it's something stunning when I saw all these pictures. You have been doing a great job with the team. Arvind, thank you for introducing me. And thank you so much for giving me this opportunity and this giving me this platform to share what I have gone through, what I have experienced in the COVID treatment. And in fact, I know almost every homeopath must be wondering what can we do. This started when we know this is the time when we as a homeopath were not even able to spell the name COVID. At least in Kerala, we were not even allowed to even treat fever those times. We had to fight. We had to go to the court. We have to do all kind of what I call fighting with the government to allow us to treat even fever. Those times we have been struggling to get into the stuff. It's not like any other state, because almost everyone, even Tamil Nadu was given permission, even neighboring state of Tamil Nadu was given permission, Delhi was given permission. In the Nehru College, we had a homeopathic room, at least wards. So everyone, we are looking at with jealous, when are we going to get all this? Till now, no. But we have been struggling with the High Court decision. We have done it. We have proved ourselves, the Kerala homeopaths. The worst thing is that Kerala has some maximum number of 14,000 homeopathic doctors in Kerala. With every village, every ward, we have a homeopathic dispensaries of the government, private doctors with what I call director of homeopathy, 5 homeopathic medical colleges. Still, we were not able to test as in a COVID patient. We fought, we spread all this in the ones. So it was a what I call do or die situation. Homeopathy was such a ridiculed by the government. Even we had a secretary of Ayush. She ordered a sentence of a statement that homeopaths will be even arrested if given for the if medicine was given for COVID. That was the statement. That was the situation we were in. Still, I can proudly say homeopaths of Kerala has done it, and I have done something. I don't know whether to tell you what we have gone through. And thank you. Let me start sharing because the time is very short. I've got only 40 minutes to share. So my approach started because this is totally my approach. I don't know whether classic or all this, because I never had a people to ask how is the things done, how the treatment is, what COVID is. We learned each and every step by our own way. We learned what are the investigation to be done. Even maybe from the patient, when the patient calls up me and tells me, okay, I've done this and this is the result, then only we know that COVID has people are doing this kind of test also, because that was a situation we are not even allowed to touch it. When people started coming, first it was preventive medicines given, then people realized, okay, there is something in homeopathy. Then people started coming because the failure and death rate was too much in the allopathy, so people started turning into homeopathy. Then we got the opportunity to, by God's time, by now I don't have the count of how many patients I've treated. Today also, even today also, Omicron, everything, at least 20 patients have given the medicines, minimum 20 to 30 patients every day, with positive cases coming into the clinic and telling the doctor I'm positive with the reports. Even the COVID, Omicron, everything comes into the clinic, gets into our chambers, and we give medicines. We don't use maximum, we just avoid maximum mask also even in the clinic. So that is the daring. We wanted to prove that homeopathy is the better choice and the best choice, and we have proved it right. So with this introduction, let me start sharing my experiences, and thank you once again for giving this opportunity. Okay. Is the screen visible?
Yes, sir, a blank screen.
Now?
Still blank.
Still blank.
Yes, now something is visible.
I have put introduction on the COVID. Is it seen?
You can see it, sir, but it's not clear. You need
This
to
one?
make it to blow up.
This one?
It's too nominal in size.
Such a huge, this one?
So actually, your laptop screen is visible. Your desktop screen is visible. The complete screen.
Complete screen. What should I do now?
Just click on that image and that will blow up.
So please download that image.
Now? Still
Yes.
the same?
It's visible.
Yeah, okay. Thank you. So we'll start with the structure. We'll just rush through with the structures and everything because our focus is on the homeopathy. So coronavirus, you all know that size of the coronavirus with the average diameters of 80 to 120 nanometer. Total molecular mass is on average of 40,000 kDa. Lipid bilayer envelope is there. This is the basics. This one. Okay, basic structure wise, we will not go too deep into it. The spikes are there. We all know that as a homeopaths and the doctors, we all know on an average corona particle has 74 spikes. Each spike is 20 nanometer, composed of S1 and S2 subunits. So all this is a academic purpose for every clinician. So this is clearly anatomy and clearly this one, which is for as a homeopath or as a clinician, it doesn't make any difference to us if the structure of the corona is this and that. So what we have to start and doing it as symptoms. What were the symptoms which we faced was corona. What I have faced was there are two type of clinical presentation. One was a mild case, another was too complicated cases. Too complicated in the sense we don't know. I will explain it to you what all kind of a complication, what all things we have faced. No, okay, this was the symptoms. Common cold, as we know that corona started with common cold, then it went into throat, then into the chest, then we had a body pain, we had loose motions, whatever we call it. Every symptom of a virus fever, every symptom of an influenza, we had that, everything in that, but in mild, moderate to severe cases. Mild to moderate to an extent because it was very difficult. Because Kerala, what we have witnessed was the moment you have a cold, start with paracetamol. The ASHA workers used to give the kit to the doctor, kit to the patient. The instruction given was, if you have a cold or fever, take Dolo or paracetamol. If you have a throat pain, start with antibiotics. If you have a chest congestion or something, refer it to the CFLT. This was the pattern was going on. We had to break that pattern. It was very difficult. The symptom was, we all know the symptom. We all gone through all this: diarrhea, body pain, chest congestions, and throat pains, ear pains, headaches, whatever we have seen in all that, bronchitis, all that. So this was the symptoms what we used to see it in the COVID. But COVID was made into a big one because of these risk factors. All know the older people were active, a lot of risk on those times. The first wave, second wave was such a mess. with older people, long-standing systemic health and social inequities. Cancer patient, if they had if they gets corona, that was a big problem. Heart conditions such as heart failure, coronary artery disease, cardiomyopathies, hypertension, chronic kidney diseases, type 1, type 2 diabetes, immunocompromised patients, overweight and obesity, pregnancy, sickle cell diseases, smoking, stroke, subcutaneous substance use disorders. All this was one of the biggest risks, and we have treated everything. Chronic lung disease, COPD patients of the old age and smokers, COPD was more, and COPD, cystic fibrosis, pulmonary hypertension, asthma. It was more than a disease. It was like what are called. It was a scary situation. Every now and then we used to get phone calls. Doctor, I'm coughing. I have this, because media has hyped it to the core. We could do a lot of things, but no one cared for homeopathy. So we could have avoided a lot of death also, but no one did it. So we had to struggle a bit to get into that shape. This is the complication, or if these people or this things, if they had in COVID, with the COVID, it was more tougher and to the toughest. So if a COVID patient comes into us with the symptoms, all this, what is to be done? You should, honestly, if you ask me, I never had any clue what to be done, what test to be done, how it is to be done. Nothing. We had to learn, relearn from juniors, seniors, from the patients. Last, at least after seeing 10 to 15 patients, listening to them, hearing them, I made this is the something which we have to go through. Because as a homeopath, lab investigation, viral fever, COVID, whatever comes in, homeopaths are very reluctant now, earlier also, now also, for the lab investigations. But in COVID, I learned the seriousness and what has to be done, what importance of lab investigations in COVID. Lab investigations had helped me a lot in treating COVID cases, because everything comes into the phones. I used to talk to them, okay, what is this value? Okay, then this is the medicine. What is this value? This is the medicine. Patient comes and calls me from ICU and tells me, okay, Dr. D-dimer is this, what to be done? Ferritin is this, LDH is this, that is this. So we were not even being able to ask what are the symptoms. Symptoms, everyone has the same. ICU में है क्या पूछना है, ventilator में है क्या पूछूं. So everyone had a common symptom, no particular symptoms to be asked, how to ask. No. Everyone has the same thing. So what are the lab investigation I relied on was CBC. Either the hospital does that or the people in and around gets it done. So this is the report we relied on. CBC, complete blood test, CRP, LFT, liver function test, D-dimer, CKMP, troponin, LDH, ferritin, serum amyloid A, X-ray, CT scan. These are the basic, and these are the majority of the lab investigation I relied on, and I have asked the patients to do it. Will this help us? How does this help us? Even now also it is reliable. Even the Omicron also, these are the basic tests. We have to get it done if the patient comes in. And this was the thing we relied on. Complete blood test. Why should we do a complete blood test? Lymphopenia, eosinophilia, platelet count was low. So this, why complete blood test? ESR was high, platelet was low. So this is the test, basic test to be done. Thrombocytopenia, then C-reactive protein. In any inflammation, C-reactive protein. Why the C-reactive protein was more important for us homeopaths was, any doctor who sees COVID and CRP, he says that, okay, this is it, your CRP is high. You have to go into the hospital. You have to be admitted in the hospital, isolation. CRP was a basic test to, even if it is rheumatoid arthritis, any inflammation, CRP will be high. So people were not taking, or the doctors were giving too much of importance to the CRP, and they were been sending it to the hospitals or CFLTs. And being in Kerala, you know that Kerala was been the what I call, Kerala was known as one of the whole country was looking into Kerala, what Kerala chief health minister was doing it for the COVID situations, how they were tackling it, how they were maintaining it. Oxygen was abundant here. Hospital facility was like anything. CFLT means whole of Kerala, every little places, every village has CFLTs. Every district has, I don't know how many CFLTs we had. So infrastructure wise, Kerala was the luckiest in Corona. So when they had it, IMA was doing a lot of muscle power, because every infrastructure, homeopaths never had any infrastructure. We have a clinic, but we don't have an infrastructure. So IMA was muscling with that infrastructure, and they were bullying on the ministers. And election was nearby also. So everything was there. So any doctor who comes up with CRP will be sent to the hospitals, private hospitals, government sectors, everywhere. So CRP was something which we have to tell the patient that CRP high is a normal phenomenon in any inflammation, making them understand those the biggest worry we had as a more than treating the patients. People were that scared. Then liver function test. Why liver function test has to be done? Because COVID affects the liver. Bile was our cholesterol, all the cholesterol level or the what I call lipid tests. All the lipid tests was high. Alkaline phosphatase, SGOT, SGPT, all the liver parameters was usually high in that COVID. I don't know whether it is due to the medicines they've been taking it, or what are the majority of this 50 plus patients they had liver function test high. And D-dimer, this was the funniest thing. D-dimer, I'm hearing it for the first time in the COVID. As a homeopath of had almost 22, 27 years of 25 years of experience, D-dimer, rarely we do it. Even in any other country, D-dimer is one test we learned from the patients, from the seniors, from the others who did it. We researched it. When we saw the D-dimer, I did all the researches, and the funniest test, D-dimer little high, and patient will be sent to the ICU. So this was the situation we all faced as a homeopath all over India, all over the world. We have faced it. Whether we have a medicine for this condition, whether we have to treat this, what level we have to take the case, what is the condition we should be thinking about it, God knows. I never knew it, at least. Creatine kinase, new corona, immune mediated pathway. So creatine kinase was the one of the highlighted test for this COVID. It is that enzymes, immunities, and everything has been tested here. It was to check it out. So creatine kinase was, that was also first heard of, but never tried it in any patient, because this was of no use for us earlier. We never used to do this kind of a highly sophisticated test. Troponin, as a homeopath, hardly cardiology cases came very rarely to us. So troponin also another unknown or less known variant test. LDH, severe infection across cytokine immediate LDH release. LDH is Okay, LDH. This was related to the muscle breakage. That was one of the symptoms. Pain, body pain was severe body pain. Every muscle, every strain, every muscle strain was painful. It was like a needle. So LDH released, it was with the troponin, LDH, this cytokine mediated test. This was another indication, or if this was high, we had to give medicines. Ferritin was fun. First, I thought this ferritin is something related to iron content, homeopathy, ferritin medicine, ferrum, everything. So, pro-inflammatory effects. Ferritin, this breakage also causes lot of body pains and stuff like. So, this was the investigation. Mainly, I was relied on serum amyloid A, SAA. Concentration was significantly higher in COVID-19. So either of this, some things, we used to get it in COVID. One patient had the dimer, one patient had the amyloid, one patient had the ferritin, one patient had that. So either this, everything was high, either a smaller one was also high. And the last and before that is the X-ray. Pneumonia was a basic, this one, pneumonia, slightest patches of pneumonia went into the ICUs, hospitals, ventilators. Luckily, we had X-rays. In Kerala, 90% of these people had X-rays. Where the patients we all referred from Delhi and Bangalore, first line was CT scan. CT scan was the funniest thing which I ever heard in this COVID. It was like every CT scan had 15, 18. It was like a football game. 19, okay, score is high, 16 is there, 25 is there, 5 is there, 7 is there, 5 will be in first line. So this was it. Ventilator, people call from the ventilator saying that, okay, 24, 23, 27. This was real fun. And I do have to appreciate a junior or whoever it is from Delhi, and a senior doctor which I had associated was Dr. Maria Philbert when this COVID was there. Delhi, Dr. Tripti, one Dr. Tripti Rai, she's also a member of DIH in Delhi. Amazing. She has done a lot of work in Delhi during this COVID. And the junior is, I don't know how much, she has been 39 or 40 years, but in the clinic, homeopathic field, maybe 4-5 years. That's the history we have been associated. 4-5 years of treatment line, and the amazing way of dealing with the COVID. We have done it as a teamwork from Delhi. She used to call me, ventilator, ICU. We used to 3-4 days, the guy was out of the ventilator. That was fun of it. Okay, that was real fun, and the courage she took it, being very junior, to get out of these people from the ventilator. Even UP, she had patients, Delhi, she had patients. God knows, it was amazing work. Dr. Maria, all know she is a very senior homeopath. Even from Delhi, all the seniors, juniors, everyone taught me a lot of lessons. My patients taught me a lot of lessons during COVID. Okay, these are the investigations. And before going into the treatment aspect or usual approach, what I had to do it. So COVID, my approach, this is the investigation, we do it. After that, once the diagnosis is done with the COVID, RT-PCR or this one test, usually RT-PCR used to come with X-rays, CTs, everything. Then as a homeopath, we have to give medicine. My approach was, there are two kind of treatment was there. One is mild cases. In the first line, if you get the patient, mild case approach was there. Then went into a very complicated cases. very complicated. I will give you 4, 5, 10 cases of very severe complications. Okay. And I'll go into the medicine part of it with lab reports and symptoms, basically on the symptoms as well as the lab reports. Our treatment approach: mild medicines as phosphorus, bryonia, hepa, sulfitolacca, gelatinum, restox, everything. And potency were little higher. I used phosphorus is only 30 potency, then bryonia higher, 1M, 10M, hepa, sulfitolacca 30, 200, 1M, gelsemium, restox was for 1M and 10M. This was used in mild cases. Why potency was higher? Is patients were very sensitive, patients were very scared. So more the sensitive, more the higher the potency. So that was my approach in the mild cases, and it has given me a lot of results. You cannot even count it. Okay, this was the approach. Okay. Medicines, basic medicines we have used is, if the thrombocytopenia is there with the patient COVID and thrombocytopenia with all the symptoms, this is the lab approach. This is the lab approach. Symptomatic approach is entirely different. If you have, this is the lab approach. This is the medicines I used to give. Complete blood test. If there is a thrombocytopenia, phosphorus, X-ray. These are the 2 medicines out of 3,000, I don't know, 3,000-4,000 of cases which we have treated. No cases without phosphorus. If there is a thrombocytopenia, 100% phosphorus is there. Thrombocytopenia, if it is less, X-ray 30. X-ray 30 to 100, it goes on. With the platelet improvement, 30 is to change it to 200, and the frequency is to change. Phosphorus 30, I've repeated every 2 hourly, even half an hourly, 15 minutes, depending on the severity of this one. If the thrombocytopenia level was almost 5,000 to 10, less than 5,000, 10,000, this medicine used to be repeated very frequently in 15 minutes. If the ESR was elevated in the lab report, tuberculinum 1M HS every day, arsenic iodide 30 every 2 hourly, or 30 days or QDS. This was the approach we have to take it, because no other symptoms was available. If there is a symptoms available, or the symptoms, other symptoms available, we have added or prescribed on the symptoms available. Okay, LFT. When the LFT is high, the foremost and the best medicine which gave me help was Calmag. Calmag Tincture, Calmag 30. LFT high, SGPT, this one high, alkaline phosphatase high. Calmag was one of the best medicines. Picric acid 30. Picric acid 30 is with jaundice. Picric acid 30 is one of the best medicines. Indications I can give you: Chelidonium, Chionanthus. Chionanthus, one of the another medicine which has helped me in a lot of cases. D-dimer. That was the best part. D-dimer, if it was 1 point high, God, patients used to kill us. Every 5 minutes, every 10 minutes, every 15 minutes, used to get call from the patients with the D-dimer high. I was wondering what to do. Did a research, spoke to each other, a lot of researchers, a lot of things. And the best thing was phosphorus again, and Crotalus horridus. I can give you the results of 5,000, 1,100, which came down in 3-4 days time. Doctors left it. We made her recover from ICU. D-dimer 40, D-dimer 5,000, D-dimer 1,700, 1,100, 500, 700, 800. It was fun. Only thing we ask is how much is the D-dimer. We used to get the medicine, we used to give this. Crotalus horridus, amazing results. I can even close my eyes and say what are the medicines given to this patient, that patient. What is the Crotalus horridus? Hey, availability of Crotalus horridus was made by with talking to all the labs, all the homeopathic pharmacies, that the patients used to call me. Troponin was another one. Adrenaline 30, Cactus cretiagus. Adonis is also another one medicine which I forgot to write it here. Adonis was another medicine with the troponin high level of troponin. Adrenaline 30, Cactus, adrenaline 6 also I have given it. Cactus, tinger, repeated, frequent, because there was no other choice. Patient is in ventilator, ICU with troponin high. Ask the patients to give it with the hospitals. Luckily, few of the hospitals supported us. They said we cannot do anything, do whatever you want. So we had given all these medicines with the support of allopathy, with the support of other doctors. Everyone has contributed to this. This is nothing my one. I had a team of at least 10-15 doctors where it was just on tip of my this one. Any symptoms I needed it, I had to, because calls used to come, like it was flooded with the call. So I have to just one symptom, one patient gives it, I have to give it to the other doctor. We used to support when they have it. I used to help us. That was the medicines. Other things. That LDH high. LDH was high lipidase where the muscles used to get weakness, body pain. Natron salicylicum. Natron salicylicum is one of the best medicines where you can rely on the weakness and muscle pain. 30. Salicylic acid is there. Sarcolactic acid is another one. Acid lactic acid, sarcolactic acid 30 is another medicine. Macrotin, Ipetorium, Gelsemium, Belladonna, Rustoxtenum. Macrotin was one of the best medicines. It has given me good results for the backache. The patient was Ipetorium, was not responding. Macrotin has helped. Even cobaltum is another one of the best medicine we have treated with in COVID back pains and body pains. Back pain was one of the best ever possible. Macrotin was one of the new medicines which we never used it before. Macrotin was helped us. Then Ancaria. Ancaria was another medicine which is helping us. So those are the medicines. Ferritin. If the ferritin was high, Bryonia tincture. Phosphorus 30. Creatine kinase was high, Bryonia and Ipetorium 30. So this was the medicine where I had to give it based on the lab reports, X-ray and CT scan. Bryonia tincture was repeated like anything. Bryonia tincture, if the CT scan had a ground glass appearance, read boric, Senega tincture is a messiah of COVID. I would ever say that without Senega tincture, none of my cases would have been successful. You read Bryonia, it clearly read boric, it clearly writes that lung, ground glass appearance of the lung. That was the only indication was enough for the Senega. Senega has helped like anything. It was a miracle medicine during COVID. Bryonia, again, pneumonia, consolidation, and honeycomb appearance with glass this one. Grindalia with night discomfort or night dyspnea. Aspidosperma. It was a trend, but I never used for this. If the patient had COPD, if the patient had a COPD and COVID, not because of the oxygen was less. If the patient had an indication of COPD in the case taking, if we ask them if we get it, if the patient was a smoker, if the patient had a COPD, Aspidosperma was given. Aurelia, if it is with the cough, discomfort with cough, Aurelia was given. With the sneezing is also there, Aurelia was given. Throat infections medicines were Phytolacca, Belladonna, Baptisia, Hepazole. SPOT low, Vanadium, Aspidospama, Carbovage, Bryonia, Grindalia, all those, this ones. This was the approach with them, and symptomatic, every symptom, if we get it, depending on that, we give the medicines. As every homeopaths have done it. But 90% of the prescription, I can say around 70 to 80% of the prescription was based on lab only. 20% I used to get it. I'm not talking about the cases of minor complaints. I'm talking about the cases of patient admitted in the isolation wards and a patient was in ICU. This is the cases I'm discussing it here. Mild, moderate, you know all the symptoms we used to give our small, every homeopathic doctor know that. These are the symptoms. I have given you few cases. Okay, this Mariama 73, she was also from this one. Pandalam, it was almost I think 150 kilometers from Cochin. 3 hours or 4 hours drive from Cochin. And this patient I particularly remember was my friend's family friend's mother. She was admitted in a hospital, not because of the COVID. She was admitted in the hospital for a mitral valve regurgitation. She was with the pacemaker. She had to replace the pacemaker. And the right hand side, this lady, that lady who is sitting on the chair, this lady is called Mariama. Okay. She was admitted in the hospital, the wall in replacement. Suddenly she developed the symptoms of discomfort. She had a pleurisy, she had a cardiac issue. And this lady, she was in the hospital for 10-15 days, almost 22-23 days. They were not able to replace the mitral valve, that pacemaker or wall replacement, as well as a pacemaker. It was one of the biggest hospitals. They said nothing can be done. She is going to die. If you want, you take her home. I asked them. So he called me up, said, is there anything can be done? I said, let's see. We will take a risk. I asked them what was the condition. She said nothing. She's lying down, no, not eating, just as this one. I asked, did they do any test? They said nothing. COVID is negative. COVID is negative. What to do? I asked, was it done at any CT, X-ray, anything? 3 days of medicine was given. Loracerosis was given. Bryonia was given. Nothing was helping her with I was scared even to give phosphorus because all this. And 4th day or 5th day of talking to me, they sent, doctor, I forgot to tell you, they had taken a CT scan. CT scan showed the ground glass appearance. One line of the CT scan. I think I have kept it on the CT scan and that. One line of CT scan showed that ground glass appearance. And what I gave was Loracerosis tincture and Seneca tincture with the Bryonia. 2nd day, that means 6th day, she started recovering. And she is still alive. She is eating. She's walking around. She was, this is 7th day of treatment. Those days only with, they used to buy the medicine from the homeopathy medical store nearby, and that doctor, he was a doctor, and scared to even think about giving the medicines because whether the bystander had a COVID, he was also scared. Last medical store people gave it, and with all the support, she is alive now. 7th day, 8th day, she was negative. She was fit enough. She is still with our medicine. no wall replacement, no pacemaker done, still with homeopathy, and she is doing wonderful. Second patient is Zenat Harris, and this lady sitting with the plate, eating. Zenat Harris is my mother-in-law. My mother-in-law, and the fun is that my mother-in-law, my brother-in-law, my everyone. ये बोलते we say no, something happens, it happens for the good. My father-in-law called up my wife, and they were discussing the mother is having COVID, what to do. She doesn't want to go to hospital. What she says, whoever goes to hospital comes in the coffin. So she said, I will die at home, but I will not go to the hospital. I never know. I knew that she had a fever. I never knew this was COVID. My brother-in-law's wife was a cousin of another doctor. So she was taking medicines. I overheard this, talking to them. I said, if you take the risk, I am ready to take the risk. She's my mother-in-law. So I was in between, I was sandwiched. You said no, devil and ocean or something of that sort. There's a saying. So my mother-in-law, D-dimer was very high. COVID, CT scan was high. CT scan was showing 17 score. So they said, even they called up religious people. That was also, she was given that we say I'm a Muslim, kalima over the Zoom. So all this was done. She was ready. But with our medicines, all this, I gave her Bryonia, Senega, phosphorus, without phosphorus. Even now, I don't treat any COVID. This lady, perfectly healthy. 5th day, she recovered. Didn't even go to hospital, didn't even go to any isolation, didn't even take any allopathic medicines. And this lady or mother-in-law made me proud in our community or the relative. She was a brand ambassador in my community. At least in Bangalore, I have treated almost 100-200 cases from Bangalore just because of this. And Shama was another lady. She was a first case of diabetes. Obesity, she was 102 kg. 102 kg, diabetes with COVID. She had a migraine, she had a sinusitis, and she had a COPD. So all combined in this lady. And she was also another, I couldn't take her picture because she was reluctant to be in the picture. And the worst thing is that her son was a COVID warrior, but she was an ardent, hard homeopathic believer. I don't know how these people believe me or homeopathy even at this stage. I wondered her guts. She said, I'm not going to go to any hospital. I will treat with homeopathy. And she heard this. My mother-in-law was recovered in 5 days' time with our medicine. And this lady with all this complication, and we said no, with all this complication. And she was 64. That lady was 72. I've written the age. Mariama 73. Zenat Harris 64. Maria Shama was 72. Her D-dimer was 1,100. I have a report also. 1,170. Recovered for phosphorus and Crotalus auridus. Kali bike was given for sinusitis. Senega was given for her this one. PQRS symptoms, we are not getting it. I was not able to elicit because Bangalore and Cochin is 450 kilometers and patients were worried. Bystanders were worried. Son was worried because he's a COVID frontline warrior. So they were telling her to go to the CFLT, ICU, everything. She said, no, even if I die here, I will die with the family. She was isolated and whole family was having it. With that lady, started treatment, everyone, I had it, their patient. So Shama was that. Lily was from Thrissur, almost 70-80 kilometers from here. She was in ICU and she was a patient of my junior. She was grandmother of my junior. Her D-dimer was 5,000. It was brought down. They wrote of ICU, cardiac ICU or a corona ICU. They wrote of this patient 5,000. I'm not exaggerating. Her D-dimer was 5,000, brought down in 3 days' time. I have a record. I'll show you the record. It was an amazing, miraculous response. Crotalus auridus, Senega phosphorus. This was the medicine which brought down this patient. Okay, Lily, same, almost every symptom, weakness, everything was there, but was in ICU, ventilator, with each case has one or two other D-dimer 5,000. I was really shocked. D-dimer 5,000, what to do? But took up that. I said, anyway, the patient is going to die. Let's take a risk. And that risk paid off. And Naz is a patient who was daughter-in-law of Shama. Naz became very special because she was 6 months pregnant. That was the first case. Pregnancy was another complication. This Google has created a lot of hangamas. They have done a lot of research. Naz was a pregnant patient, 6 months pregnant. There were two worries that anything will happen to her, anything will happen to kid, that baby, fetus. It was not too complicated case, but her anxiety. Pregnant patient was first case for me, as well as her anxiety. All the others were COVID patients. Mother-in-law COVID patient. The family was into COVID patients. So I really don't know. So this was another one. Zainul Abdin, another 74. He was diabetic. He was in dialysis. He had a pancreatic. What was that? Pancreatitis with the medicines. He was in with all the pancreas medicines and the steroid also. We had to withdraw all this. It took a lot of time. It took a lot of struggle. Every half an hour, every 1 hour, I had to monitor. This is one of the toughest cases I faced with the pancreatitis. With COVID, was not even able to eat. The pain in the abdomen, it was like what I call hard abdomen, because you know the peritonitis, the pancreatitis, pain, rigid person. It was a hell. It made me, I don't know, it made me a COVID specialist. This case. Zainuladin, still alive. All these cases, I can give you phone numbers, addresses. This is a few cases. I've just shown it. Okay. Rajesh Thrissur, he was second COVID, that COVID, this one, what I call, in that COVID
second wave.
Rajesh was in ICU, that was medical college ICU. Luckily, I had a friend there working. Homeopathy, he was a vice principal of that college. MS, first time he somehow recovered, went home, discharged. Third day he got it again. I don't know, it was a first stage, second stage, but it was proved negative. They discharged him, went back home. Then third day or fourth day he got it again. That time they said nothing can be done. ICU, we will keep it in the ICU. Usko marne do. but this relative somehow came to know, somehow some patient told them, okay, there's a doctor in homeopathy, why don't you talk to him? Relatives called up and they spoke to the doctor. I didn't know he was also working there. He heard my name. He heard one Dr. Sadath Sait. He wanted to give medicine. Can we give? He said anything can be done. He heard Sadath Sait. So he was my schoolmate. And he has become a principal of that medical college. He called me immediately. So we said, we have a homeopathy, have a allopathy, homeopathy fight. Nothing. Allopaths have supported us anything in my health, my experience. He called me up immediately. Sadath, what are you doing? This is why don't you give medicines immediately? I said, with their permission, their ventilator support, their every support, this guy came out. 5th day, he came out of this ventilator and he came out of the room, out of the ICU. Still alive. And the best thing is he was diabetic also, 31 years, diabetic also, alcoholic. So that made me get a lot of patients from that medical college of this kind of this ones. And Abdul is just two years. And this baby is very, 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 very dear to me because his parents were having primary infertility for 10 years. He was born with my medicines, and this guy had a COVID. 2 years. He was from Kasaragod. Kasaragod is like end of this one next to Mangalore. It was almost 400-500 kilometers from Cochin. This patient was not too because of this one. 2 years. That time people have been telling that second wave, people used to tell that kids were not getting it. But this proved wrong. And it was a very special and precious baby. And after he was born, I used to get at least 10 to 15, 20 cases. Even now, yesterday also I had this parents referred me another infertility cases. They used to keep referring me. So this Abdul too was my own, you can tell that my own child. And he had COVID of 2 years. This proved wrong that those times we were never heard this one. Kannan, another ICU in a Manjeri. We have a place called Malappuram, Manjeri. ICU. Again ICU with the support of doctors in ICU, medical college. We could revive, we could bring him out. Same, almost wrote off most of the cases. And Rahmat, another cases, Rahmat 91. She was not too big deal or the COVID, but this was 91 years. And the best part is, I never had anything. We were just trusting God and homeopathic medicines. That's it. I have not seen the cases, even ICU. I cannot even see the cases in WhatsApp also. I cannot even have the video call also. These are the cases. It has to be added. A lot of cases to be added in this, but this is just few. This is the Lily cases, her X-ray. And this is her 5,000. If you can see this, this is the lab report of 5,000. This is something which, this is another 1,170 of Shama. D-dimer of 1,170 of Shama. Lot of this. And this made us, by God's grace, now I am known as a corona doctor in Cochin. So these cases, this taking risk, I don't know. Honestly, I have to thank all my juniors, all my seniors, all my teachers. to take this kind of a risk where when homeopathy was not even allowed to give, homeopaths were not even allowed to give medicines. By that time, all the UP to Tamil Nadu to Delhi to every state in India was giving homeopathic medicines without even bothered. They were given permission, even the Gujarat. But Kerala, we were not even given the permission to give it. But this was a risk. I said, come what may, they wanted to arrest me, they wanted to put me in jail, let them do it. It is for homeopathy. I just wanted to take a risk because homeopathy was shabbed. Homeopathy was like insulted like anything. That was this one. And thank all my juniors, Tripti, Dr. Maria, Dr. Biju, Dr. Chandravanu, a lot of my teachers for this kind of achievement. Hi, last week also from Kannur, the patient had a stroke. His name is Abdullah, 86, unconscious, stroke, dementia, diarrhea with COVID. I couldn't add it into it. COVID. He is healthy, perfectly all right. 5 days it took to be a negative with homeopathic medicines. My job was to treat him COVID negative. We could do that. And he has a slight diarrhea of 2 months old. 2 months, history of 2 months of diarrhea. Because he had a lot of other complaints. He also survived only with our medicines, no other ancillary measures. I don't know the ancillary measures could be given to. Shama never had ancillary measures. Oxygen was given at home. Yes. With their support, respiratory, lot of medicine. These are the medicines. Details, I know that you all know homeopaths. These are the medicines. I don't have to go on repeating why we took it. Alternations of taste, bitter. Lot of this one. And Magmure. Magmure was one of the medicines which could help of the taste. And the taste was like a usual taste we used to get was like a burnt meat. That was the majority of the cases we used to get. Burnt meat, repertory, no medicines there. It was very difficult. We searched all the repertory. We were not getting it. Synthetic repertory, synthesis, complete repertory, synthesis, boric, burnt meat smell. Someone tells that it is like charcoal. God knows what all things we used to get it. And black fungus, one case, my own mother's sister, COVID, she was treated with allopathy and steroids. She had a black fungus. That's the first case of only case I got it in black fungus is my mother's sister. They just rot off. They wanted to take off the eyes and stuff like that. Kali bike and black one was Kali bike and Silesia. That gave me a wonderful result and she was out of danger maybe around 4-5 days. They were planning for a surgery. My mother's sister immediately called me after 5 days after she was almost recovering from COVID. It was getting into a post-COVID time. She started sinusitis, and when they took the CT, it was found that she has a this one black fungus, and they never knew. They didn't know what was. So this lady, this Shama was also her relative. They knew that Shama recovered, so immediately they called me up. COVID, they didn't call up. After this one, this case, black fungus, we could do a lot of things with the black fungus. So these are the medicines: belladonna, lobelia. This was one of the medicines which has helped me a lot. Even this lobelia and Loracerosis was given to that Mariama. And still going on. Every day, 22 to 30 cases of Omicron. You call. Now the fun is that every day we get. Today is Delta. Another day is God only knows what kind of variant is going to come. What are the names that are going to be given? But homeopaths take the risk. Whatever the kind of cases, we have the medicines. We can treat the cases. The kind of risk we took it. That was utter. I don't know whether now COVID is like anything. I don't know what made me take this kind of a risk. God knows. That was a sheer, we say now, the frustration of treating homeopathy like hell. So that made me take up these cases. Now I'm proud to be a homeopath. We get every day. Yesterday also, patient came to me, liver cirrhosis. It was asked to what are called transplant liver with edema, everything. Developed COVID now. But see, they are in a CFLT, but with our medicines now, monitoring it right now with cirrhosis, with hypertension. Now Shine, his name is Shine. Now they are better. So these are the things which I could bring it. Difficult cases, little more to be added, but this is the main reason because of the time. It is almost 8 o'clock, so let me wind up. Thank you for giving me this opportunity to present this in Dreams and DIH. Thank you so much.
Thank you, Dr. Sadath. You really kept us glued to the screen. It's very interesting to see how you prescribe based on pathology. It's really very interesting. Hats off to you. You just kept us, glued to the screen.
Can I stop the share?
Yes, sir.
Anyone can ask me, or if any have a doubt, you can call me, you can talk to me.
So we will have the question and answer session after honoring our respective doctors. They will also share their experience. COVID has given us a very bad time and very good things in the bad times. A silver lining of the cloud, I will say. तो बहुत सारे डॉक्टर्स ने आपने भी बहुत अच्छा काम किया डॉक्टर सदाथ, really appreciating and really claps for, hats off to you and claps for you, really claps for you. The on pathologically prescribing thousands of patients, as you have saying that you have seen. So there are more doctors we want to honor who have really worked a lot for COVID patients. So I invite Dr. Arvinder to please invite them, introduce them, and honor them.
Sure, ma'am. Thank you. 2020 and 2021 were the years of disaster for the mankind. Pandemic led us to lockdown to stop the spread of novel coronavirus. It was virulent that it caused so many deaths throughout the world. At such times, these fierce doctors, corona warriors, were extending their services to fellow human beings, not fearing the communicable disease and its aftermath. Standing by their oath, we are giving a small appreciation on behalf of Dreams and DIH to few of them today. The first and foremost, to start with, Dr. Jaswant Patil.
Hello, everyone. Good evening.
Good evening. Dr. Jaswant Patil is a known name in chest medicine and in homeopathy. A proud allopath turned into a homeopath. He has treated more than 80,000 patients with combination of Ayurveda, homeopathy, and allopathy in his hospital, in his chain of Ganga Deep. Over to you, sir, to share your experience with us.
Thank you, Dr. Arvinder, and thank you, Dr. Anupam, for inviting me in this wonderful session. I'm sorry I was busy, and I promised her to join the last half an hour. And I was listening to Dr. Sadath and the wonderful job he has done. So hats off to him, that way he has handled. And that is what I was experiencing even during my treatment during the COVID first wave, which was very new and frightening. And he has done in the state where there was a lot of resistance. I had got some calls from even Kerala that, can you speak to our government, you are getting so much of result, why homeopathy should not be allowed. But it's all falls on the deaf ears when your eyes are blind and you don't want to see anything what is happening except then what you are preaching. So it is a time-tested homeopathy in different epidemics of the world, where it has proved to be our number one science, saving more lives. But I always feel that those who have done good karmas, they only get the homeopathic treatment because it really saves them. And doctors all over the world who are practicing homeopathy, they know the power of the homeopathic science. But unfortunately, the license, I would, in a harsh word, say license to kill is only with allopathy, not with homeopathy. Because by chance someone dies, I was appointed by Ayush Ministry, our homeopathic commission, to carry out all the trials in Maharashtra. I am Maharashtra Task Force member of Ayush, and I prepared one moderate to severe cases study, because if you present on mild or moderate, early moderate, people say they get well on their own. So what homeopathy has done? So the real challenge was treating ICU cases and the severe cases. I went to them with a proposal, and it was very difficult because no homeopathic college was nearby in the surrounding area to give the ethical committee pass out. I had to work very hard to get ethical committee approval. I got it finally. It was after 1 year of full efforts. Then I got it finally. I went to the health secretary. He said, if one patient dies of homeopathic treatment, there will be hue and cry. There will be parliament questions. I said, some thousands of people are dying. When even allopathic world doesn't know that whether remdesivir is really working, plasma therapy is working. So they are all trying. This all trial and error going on, and these are harmless. And I'm not asking that give us full-fledged. We are, as an adjunct to allopathy, you are already doing where the cases are failing. You're not getting the result there. At least let us try, because it's already given a hope, and that too with the permission of patient. We are not forcing on anyone. But he said no. I believe in homeopathy, but there are certain rules that we have to pass through and clear. And that time I felt that we need an ICMR-like body, individual body who would approve homeopathy as a first science, whatever. And it should be open to the public. Public should not be forced, you take only this treatment. Give it to them. If they want homeopathy, they will come. Don't stop them. Don't stop them, because if it is not a good science, why the homeopathic commission is formed? Why the Ayurveda commission is formed? That should not happen. And finally, it's always that homeopathy is kept aside, and the day will come when homeopathy will be in forefront, I'm sure. Dr. Sadath has presented the cases and the information very rightly, because what first I was practicing giving classical 1 dose of homeopathic drug and Singh, and I was failing. Then I said, Dr. Hahnemann has said one word, dare to be wise. And that dare to be wise, you have to be wise at the right moment. Otherwise, you will miss the bus. And then I said, no. What is the main remedy selected? Constitutional, that you can miss. But the complementary follows well medicines, one which is supporting another action, should be given, because we don't have time. This disease is fast progressing. It doesn't give you time to think. And you have to, what he has rightly said, it is a hell of a job. I can understand his pain, what he must have gone through. I used to be awake till 4 o'clock at night, sleep, and get up again at 6 o'clock, sit on my computer and finally repertorize and see. Even if you miss 15 minutes, the patient can die. From the last moment also, the patient suddenly, I remember one patient whose BP dropped down suddenly, and he was in a shock state. And they said, now it is gone. I said, put a camphor immediately. And I used to keep the medicines kept ready with the patient, because at night, what medicine will be required? So I had made a list of 50 medicines. You get these 50 medicines and keep it with you. And 1 dose of camphora, 200, immediately brought the blood pressure up. If it was a volumic shock, hypovolemic shock, what works better? Veratrum viridi. Because it is to give immediate results. Within fraction of seconds, the patient used to start responding, and 2-3 minutes time, the BP is up. the NORADs reduced to stop NORADs. So this power of homeopathy, which I had seen, it is unbelievable, and all this, like Dr. Sadath has done, so many doctors of homeopathy have done. What is my feeling is that we should have one common platform that should be through the CCRH, that all these cases should be put on a portal so that the whole world can see, and that should be done properly with the help of those who can present the cases. The data has to be analyzed properly. Unless the world comes to know about it, and it is what Dr. Sadath is doing the job, what all our colleagues are doing the job, it is at the individual level. It should be on a common platform so that any person, if I want to say my health secretary here in Maharashtra, go and visit this website and see what the homeopathy has done, then you will believe it. Otherwise, it is difficult. Somebody is asking Hanuman that you are a Ram Bhakt, show me by pulling out your chest is not possible. And therefore, we need an unity and this proper platform where we can voice our vote that, yes, see, these are the things which has been done. And these are the cases. Even allopaths have given, those allopathic doctors, COVID hospital doctors, the owner of COVID hospital, when they suffered COVID, I had a chance to treat them, and they have given video, which I had shown in this. The government should take a cognizance of this. Even then, I do not know what's the problem, but the problem is there. But no one can deny the powers of homeopathy. Thank you so much. It's already late. I would not take time. I thank you, all of you, for inviting me to such a wonderful session.
Thank you so much, sir, for sharing your experience.
Thank you, sir.
Thank you.
At the moment, we are honoring you virtually only. When the time permits, when we are offline, we will do it physically also. Thank you, sir. It's honor to honor you. Actually, it's honor to honor you.
It's an honor to homeopathy, not to me. And it's an honor to the powers of homeopathy. And because homeopathy is a science which I know it has given a wonderful results and saved so many lives. It was very difficult for me to turn from allopathy to homeopathy. But ultimately, the powers that I have seen with my own eyes, I worked in ICU for 5 years, different types of ICU. I had never seen the magical recoveries. And that too, I was not an ace homeopath that time, just prescribing on a clinical and pathological rubrics that you give this immediately. Even my father, who was in a coma after having suffered a stroke, and that time I just gave him arnica, apis, followed by cactus G, because cactus improves the blood circulation. Apis will reduce the brain edema. Arnica will take care of the ischemic injury. And within 1 hour, I had not taken him to the hospital ICU. He was almost 82 years old. Not even one aspirin, not even one blood thinner was given. He was my father. I was taking that risk because I had an utmost confidence in homeopathy. 1 hour's time, he was started regaining his consciousness. And when he was 100% paralysis, not even the finger was moving. And with that, then he started crying that why you are treating me? I don't want to live this paralyzed life. You should let me go. And the father, who never cried in his life in front of me, with slight emotions, seeing this person, seeing that person, and he started weeping. So the weeping on slightest emotion and left-sided paralysis, immediately it struck to me, it's a lachesis. I gave a single dose of lachesis 30, and you know, the full of the brain MRI which was done, half of that was showing all of the thrombotic infarct. It was really surprising for me that he recovered within 1 week's time, a grade 2 power. And at the end of 28 days, I brought him from Jalgaon to Mumbai because I'm in Mumbai in a special ambulance. And at home only we treated him. On 28th day of the treatment, with only homeopathy, not even single allopathic drug. He had a evening walk at Zoo Chopati. And that power I have seen with my eyes, and therefore I have more faith. But sometimes, because of fear, we, even as an allopath, as an homeopath, we resort to things because only one place where I take a help of allopathy is in the heart problems. Because, heart problems, patients die like this. What Dr. Sadath has said, he has used Loracerosis. Now, why? What is the main action of Loracerosis? It is a left ventricular failure. Moment you get a RALS in the up and this, it is a left ventricular failure. You give Loracerosis and it brings out the patient faster from the cardiac failure. There are so many stories to change. Time is a limit. I thank you for.
We will invite you again.
Thank
you. We have to do another webinar with you. That is due.
Sure.
Thank you so much, sir. Thank you so much for your time. Moving on to the next physician, Dr. Inkush Buddhiraja, EHMS from New Delhi, Dr. Bilaspur Medical College, 22 years plus of experience of homeopathy. Could we please have spotlight on Dr. Inkush Buddhiraja? Facilitated with Asia One Award in 2017, he is a professional homeopath, online and offline, both internationally and nationally. He has promoted homeopathy through his RB Homeo shop, and he is doing online consultation through Vincent's portal. I am glad and honored to work with him through his online portal. Welcome you here, Dr. Inkush. Please share your experience with us during COVID treatment.
First of all, a very warm good evening to all the DIH members and many physicians which has joined us today. And a special thanks to Dr. Anupam Sethi, जिनका मैं student खुद रह चुका हूँ. I really appreciate that. And I am practicing in Shalimar Bagh from more than 2 decades. And by the grace of God, I tried my best to treat this COVID cases in all the phases and got the wonderful results. And the patient has given me very good remarks on even on Google, on personal calls. And I really appreciate that homeopathic worked well in each and every way to help the patients suffering from COVID. And what else I can say? And thanks Arvinder also, Dr. Arvinder, for appreciating my work. That she has seen me working in all the this COVID phases, and really thankful to all of you for supporting this. And apart from this, I'm practicing do online also, and I'm running my own e-commerce website, which is maximum devoted to the homeopathic products. And it is one of the largest portal on which we are having a maximum number of homeopathic medicines. And my website name is RB Homeo Shop, which is in India. And very soon it's going to be international also by the name of Homeo Shop Online. As you all recognize my work and would like to have your cooperation for my website also. And thanks a lot for facilitating me, and thanks a lot, and good luck to everyone.
Experience? Dr. Anupam ma'am, would you like to acknowledge Dr. Inkush Buddhiraja?
Yes, we're just honoring you, Inkush, आपके काम के लिए कि हम आपकी बहुत प्रशंसा करते हैं. डॉक्टर रविंदर ने हमें बताया था आपने बहुत काम किया है. अभी हमको वर्चुअली ऑनर कर रहे हैं. ये आपका सर्टिफिकेट वर्चुअली है. बहुत जल्दी हम फिजिकली ऑफलाइन हमारा मार्च में या अप्रैल में हमारा होगा. उम्मीद करते हैं कि हम आपसे मिलेंगे.
Thank you, ma'am. I'd love to meet you again.
Thank you.
Yeah, thank you.
Thank you, Dr. Inkush, for joining in. Moving on to the next physician, Dr. Shashi. Thank you. Dr. Shashi Garg, MD.
Good evening, everyone.
Would we please have spotlight on Dr. Shashi Garg, another wonderful homeopath, a homeopath who does single prescription, trained under Dr. P.R.
Good evening, everyone.
Good evening, Dr. Shashi. Running her own set of clinics by the name of Pratiksha Homeo Clinic in West Delhi, practicing for more than 90 years. And we are delighted to acknowledge and appreciate that her daughter, Dr. Pratiksha, is also becoming a homeopathic doctor from the same institute from where she graduated her BHMS. Over to you, Dr. Shashi, just to share your experience. Please put your camera on. We can't see you as yet.
Yeah, it's true. Just wait.
We can't see you, Dr. Shashi.
Yeah, just. There is some problem in setting.
Just check on your screen if you're on your
It's
mobile,
off.
stop video, on video. Just click on that.
I'm clicking it, but it's not working.
Okay.
Okay.
You can have your picture. Thank you.
It's okay.
Please go ahead and share your experience with us.
Good evening, everyone. I'm Dr. Shashikar, practicing in Janakpuri. And I'm my heartiest thanks to DIH and Anupam ma'am. She's my teacher in the college, Sur College, and now even. And actually, I had joined homeopathy to serve for humanity. And I am glad that my skill was used very well in this pandemic. My clinic was open in both lockdowns. Otherwise, most of the clinic around me was closed, and even homeopathic pharmacies were closed during that time. Lockdown में medicines की बहुत problem हुई है मुझे मेरे area में. And I was giving prophylactics. Apart from the arsenic alb, I had prescribed Rhinia, Hipasal, Pipitorium perf, Ferrophos, according to the symptoms of the affected areas. पूरी lines मेरे यहाँ पे street affected हुई थी तो उसके according symptoms लेकर ही medicine दी गई है. And during the second wave, I was seeing COVID patients also because we were supposed to treat now. So I had practiced both online and offline during that time. And again, the prescription was based on the symptoms, but I had given even Hipasal, Brynia, Spongia, Pulsatilla, Antim-Tart, Calimure, and with some tinctures like Aspidosperma, Bothrops, Spongia. And I had treated very well post-COVID and post-vaccine complications. Even the high-risk patient like diabetes, hypertension, and in cancer patient also. Again, on the base, prescription were based on the homeopathic principles. And it worked very well. I got 90% efficacy. I have observed results within 24 hours, as doctor has said, our senior has said. And so the most important thing is we should believe in homeopathy as well as in ourselves. हमारे juniors को हमारे system पे अभी trust नहीं है, तो please उनको हमें trust दिलाना है. तो अगर हमारे यहाँ juniors कोई भी सुन रहा है, तो just trust in yourself. कि आपने 5.5 years इस system को दिया है, तो it works very well. So again, I'm just very thankful to Dr. Arvinder who recommended my name. She was my classmate and my friend also. And thanks Anupam ma'am again for choosing me with such of these pioneers of homeopathy. Thanks a lot.
थैंक यू डॉक्टर शशि. आपके लिए हम अभी डिजिटली वर्चुअली आपको सर्टिफिकेट अभी आप दे रहे हैं, और जैसा कि मैं सबसे कह रही हूँ, उम्मीद करते हैं कि हम सब बहुत जल्दी मिलेंगे, बहुत जल्दी फिजिकली मिलेंगे और सब आदान प्रदान कर सकेंगे.
थैंक्स.
और डॉक्टर अरविंदर, अब आप जैसे पहले कि डॉक्टर अरुण को बुलाए, मैं डॉक्टर अरुण के बारे में एक बात बोलना चाह रही हूँ. मैं बहुत देर से वेट कर रही हूँ डॉक्टर अरुण कब आएंगे. मुझे याद है कि हमने उनके साथ मिलकर एक टीम बनाई थी, और हम खुद जब हर जगह पे, जैसे डॉक्टर सादत ने बताया, डॉक्टर पाटिल ने बताया कि हर जगह पे मना किए जा रहे थे कि आप नहीं ट्रीट कर सकते, हमने एक टीम बनाई थी. वी वांटेड टू स्नेक इन समहाउ. पीपी किट्स हमने अरेंज कर लेते, सब कुछ कर लेता कि हम जाके काम करेंगे, हॉस्पिटल में जाके पूरी वर्किंग टीम में रहते, क्वेश्चनर बनाया था कैसे कैसे हम करेंगे. somehow it could not be materialized, but डॉक्टर अरुण के बारे में इंट्रोड्यूस कराया, वो बताएंगे कि उन्होंने कितना काम किया और कैसे काम किया.
Dr. A.K. Arun, please put spotlight on Dr. A.K. Arun. Dr. Arun is homeopathic MD. He is specially trained in emergency management in pandemic and natural disaster from WHO and NDMA. Dr. Arun is experienced in making public health management plans. He is the chairperson of Public Health Research Organization, that is Health Education Art Life Foundation, HEEAL. He is working intensively in COVID-19 pandemic control management in Delhi. He was conferred National Award by Government of India in 1989 and many more. He was conferred Dr. Diwan Harish Chand Professional Excellence Award from Homeopathic Board, Delhi. He has visited Geneva, Japan, Thailand, UK, USA, Cuba, Singapore for the exposure and study of traditional medicine. He is practicing and teaching homeopathy and naturopathy in Delhi since 30 years. Over to you, Dr. Arun.
Thank you, Dr. Arvinder and Dr. Anupam. मैं समझता हूँ हम लोग बहुत लेट हो गए हैं, इसलिए मैं बहुत जल्दी से 2-3 मिनट में अपनी बात खत्म करूंगा और थोड़ा बहुत क्लेम्स। वैसे तो हम लोगों के पास कोविड-19 और कैम्फोरा और बहुत सारी चीज़ों को लेकर करीब मोर देन 150 स्लाइड्स हैं, लेकिन हम 2-3 मिनट में अपनी बात करके मैं चाहूँगा कि मेरी बेटी डॉक्टर अदिति, जो हमारे साथ बहुत काम की है, वो प्रेजेंटेशन कर देगी। मुझे 2-3 छोटी-छोटी बातें करनी है। पहली बात तो मैं सबसे पहले एक्नॉलेज करूंगा, उनको ट्रिब्यूट दूंगा, जो हमारे कलीग्स थे, बहुत अच्छे कलीग्स थे, लर्नेड कलीग्स थे, जिन्होंने इसी दौरान कोविड के टाइम में ही अपनी ज़िंदगी ख़त्म की, उनकी ज़िंदगी ख़त्म हुई। कुछ लोग जो कोविड की वजह से गए और कुछ लोग कोविड के टाइम में गए। मेरे पास जो रिकॉर्ड्स हैं उसमें मोर देन 100 डॉक्टर्स हैं होम्योपैथी के, जो कोविड में काम करते हुए उन्होंने अपनी एक तरह से कुर्बानी दी। तो सबसे पहले मैं उनको सल्यूट करता हूँ, उनको ट्रिब्यूट देता हूँ और मैं डेडिकेट करता हूँ कि हम लोग जो काम कर रहे हैं कोविड-19 में, वो हम उनकी याद में कर रहे हैं, पहली बात। दूसरी बात, जो भी रिसर्च का काम था जिसको डॉक्टर अनुपम कह रही थी, निश्चित रूप से वो टीम हमने बनाई थी और हम डॉक्टर अनुपम को मालूम है, उस बीच में डॉक्टर अनुपम भी कोविड के हादसे से उनकी फैमिली में बहुत लंबे समय तक वो गुजरी, उस सदमे से गुजरी। हम सब लोग उनके साथ थे, हमारी हिम्मत उनके साथ थी, लेकिन सबसे ज़्यादा डॉक्टर अनुपम की जो अपनी हिम्मत थी, उनकी जो अपनी वाइटलिटी थी, उसकी वजह से उन्होंने बहुत कुछ अचीव किया, काफ़ी अपने परिवार के लिए। और मुझे लगता है कि वो प्रेयर और भी हमारे कई ऐसे लोगों के लिए काम आया जो बहुत क्रिटिकल हालत से वापस लौटे कोविड के दौरान। तीसरी जो जरूरी बात थी, जिसको कि डॉक्टर अनुपम इशारा कर रही थी, 6 महीने हमें दिल्ली सरकार के दफ्तर, WHO, ICMR, CCRH, भारत सरकार का आयुष, दिल्ली सरकार का आयुष, घूमते घूमते व्यक्तिगत पर्सनली मेरा लगभग 6 महीना बीत गया। और वो टाइम कोविड-19 के बहुत क्रूशियल, आप कह सकती हैं कि उस दौरान में बहुत सारे रेस्ट्रिक्शंस थे, बहुत सारे डॉक्टर्स अलाउ भी नहीं कर रहे थे, हॉस्पिटल्स अलाउ नहीं कर रहे थे। अल्टीमेटली हेल्थ मिनिस्टर ने हम लोगों को, खास करके मुझे, उन्होंने कहा कि हम आपको सिर्फ अलाउ करते हैं। इसलिए डॉक्टर अनुपम की टीम जो तैयार थी, डॉक्टर फारूकी और सब लोग, हम उनको नहीं ले पाए। कई जगह रेस्ट्रिक्शंस आ गए जिसकी वजह से हम उनको लेके नहीं गए, लेकिन मैंने कहा चलो ठीक है, हम तो जाएंगे ही। और अल्टीमेटली हम लोगों ने वहाँ से डेटा कलेक्ट किया और वो डेटा बहुत काम आया। मैं आपको बहुत ज़्यादा नहीं बोलूँगा क्योंकि मुझे मालूम है समय नहीं है। तकरीबन 700 से ज़्यादा पेशेंट्स हमने अपनी क्लिनिक में देखे। अपनी क्लिनिक को मैंने आइसोलेट किया, उसको कोविड डेडिकेटेड कोविड क्लिनिक बनाया, WHO का परमिशन लिया, दिल्ली सरकार से परमिशन लिया, आयुष डायरेक्टरेट ने हमें अलाउ किया। फिर हम लोगों ने 3 बड़े कंटेनमेंट जोन पर्सनली हील के लिए अलॉट कराए, निहाल विहार, तिलक विहार और शालीमार बाग। और उन तीनों जगहों पर लगभग 5 से 7 लाख लोगों की हम लोगों ने एक तरह से प्रिवेंटिव मेडिसिन बांटी थी और तकरीबन 10,000 सैंपल्स पर हम लोगों ने काम किया था। जो डेटा बहुत प्राइमरी था, आप कह सकती हैं कि प्राइमरी क्लस्टर ट्रायल का वो डेटा था। उसके बेसिस पर एक साइंटिफिक कमेटी जो दिल्ली गवर्नमेंट ने बनाई थी, मैं भी उसका मेंबर था, उस कमेटी के थ्रू हम लोगों ने जो रिपोर्ट सबमिट की, उसके बाद फिर दिल्ली सरकार का ये पूरा प्रोजेक्ट सामने आया। और अभी भी आप कह सकते हैं कि वो प्रोजेक्ट ओपन है। बहुत जल्दी हमारे आयुष डायरेक्टर डॉक्टर मनचंदा उसको गवर्नमेंट को हैंड ओवर करेंगे। तो ये हमारी जर्नी है दिल्ली में लेके। लेकिन इस बीच में जो जो दिक्कतें आई, मैं डॉक्टर पाटिल से सहमत हूँ कि वो महाराष्ट्र में जो काम कर रहे थे, हम लोग दिल्ली में वही काम कर रहे थे। महाराष्ट्र में डॉक्टर शंकरन, या फिर पुणे में डॉक्टर नवीन पावस्कर, और जो बजाज के प्राणा सेंटर के जो डॉक्टर थे वो लोग काम कर रहे थे। तो ये एक अलग किस्म का अनुभव था। मैं 2-3 छोटी छोटी साइलेंट बातें कहूँगा। कोविड-19 ने हमारी होम्योपैथी को और हमें, हमारे होम्योपैथ्स को कई सारी बहुत अच्छे अनुभव दिए। पहला तो हैप्पी हाइपोक्सिया एक सिम्टम्स जो इस बीच में बहुत चर्चित हुआ था, हम लोगों को, मुझे नहीं मालूम था हैप्पी हाइपोक्सिया अकेला रूब्रिक कैम्फोरा में है। इसको हमें डॉक्टर शंकरन ने, राजन शंकरन ने बताया। ऐसे ही एज्यूसिया, एनोसोमिया और भी कई सारे, म्यूकोरमाइकोसिस, ये सब नई नई जो अनुभव आए जिसको लेकर हम लोगों ने होम्योपैथी में काम किया। और इंटरेस्टिंग बात ये है कि ये सारे सिम्टम्स पर एलोपैथी बिल्कुल साइलेंट थी, उनके पास कोई इसका जवाब नहीं था। इतना मेरिट होने के बावजूद भी जो स्टेप मदर ट्रीटमेंट है जिसका डॉक्टर पाटिल इशारा कर रहे थे, बहुत सही कर रहे थे, हम सब लोग उसके शिकार हुए। लेकिन एक अच्छी बात ये हुई कि हम बहुत अच्छे अनुभव से गुजरे। हम भी CTRI के यहाँ करीब 3 महीने धक्के खाए, हम भी इथिक्स कमेटी में करीब 2 महीने धक्के खाए, लेकिन अल्टीमेटली एक छोटा सा प्रोजेक्ट दिल्ली सरकार के माध्यम से मिला और उसको दिल्ली की करीब 140 डिस्पेंसरी, जो दिल्ली सरकार की डिस्पेंसरी है होम्योपैथी की, आयुष डिपार्टमेंट की, उसके थ्रू काम हुआ। तो ये एक अच्छी बात हुई। उसमें से सबसे अच्छी बात ये हुई कि मुझे बहुत अच्छे अनुभव हुए। और मेरा एक्सपीरियंस पैंडेमिक एंड पब्लिक हेल्थ करके एक बुक के रूप में आ रही है, दैट इज बुक हैज ऑलरेडी कंप्लीटेड, नाउ इट इज इन फाइनल स्टेज ऑफ एडिटिंग, सो होपफुली इट विल कम। एंड सर्टेनली मैं जो हमारा ऑर्गेनाइजेशन है अनुपम जी का DIH, मैं उनको अपनी किताब भेजूंगा, रिव्यू के लिए भेजूंगा, और आपके माध्यम से मैं कोशिश करूंगा कि हमारे DIH के जितने मेंबर्स हैं उन तक मैं पहुंचा सकूं। उसका हार्ड कॉपी अगर नहीं भी पहुंचा पाऊं तो कम से कम उसका जो वर्जन है वो तो जरूर मैं गिफ्ट करूंगा अपने सभी होम्योपैथ को। वही किताब हिंदी में भी आ रही है। ये 2-3 चीजें थी। हाँ, एक अंतिम बात मैं बोलना चाहूंगा कि हम कहाँ फेल हुए, और मैं चाहता हूँ डॉक्टर पाटिल और डॉक्टर सैद दोनों को चाहूंगा कि वो भी इस पर गौर करें, और जितने भी हमारे होम्योपैथ हैं, डॉक्टर अरविंदर या डॉक्टर अनुपम, आप खुद भी। सबसे बड़ी दिक्कत क्या है कि हमारी कोई अपनी रिसर्च मेथोडोलॉजी नहीं है। मैं उसको बहुत लेमन लैंग्वेज में आपको समझाना चाहूंगा कि अगर हम फुटबॉल की टेक्निक लेकर क्रिकेट खेलने चले जाएं तो आप बताइए हमारी क्या हालत होगी। हमारी जो पूरी रिसर्च मेथोडोलॉजी है, चाहे वो डबल ब्लाइंड हो, ब्लाइंड सिंगल ब्लाइंड मेथड हो, आप उसमें कहाँ टिक पाएंगे। होम्योपैथी ये साइंस ऑफ इंडिविजुअलाइजेशन, होम्योपैथी इज ए साइंस ऑफ पेक्यूलियरिटीज, होम्योपैथी इज साइंस, इट्स ए जनरल साइंस। हम स्पेशलाइज्ड नहीं हैं। एक पेशेंट 10 एक सिम्टम्स 10 पेशेंट में 10 तरह की मेडिसिन को इंडिकेट कर रहा है। हमारी मेथोडोलॉजी नहीं। और ये सवाल हमने उठाया, हमने अपनी इथिक्स कमेटी में उठाया, हमने डॉक्टर्स की जो पूरी कमेटी थी, CTRI की टीम थी, उनके सामने उठाया कि सर आप इस मेथोडोलॉजी से हमारा इवैल्यूएशन नहीं कर सकते। लेकिन चूंकि हमारे पास अभी यही टेक्निक अवेलेबल है, इसीलिए हम इस पे काम जरूर कर रहे हैं। मुझे मालूम है 6 महीना पहले हम लोगों ने कहा था, हमें मालूम है कि हम लगभग प्लेसिबो जैसे रिजल्ट में आएंगे। और अनुपम जी, बहुत अच्छा नहीं लग रहा बोलते हुए, वही हुआ। हम वही पहुंच गए। अभी ऑफिशियली वो रिजल्ट आना है, लेकिन हमारे बारे में जो एलोपैथी वाले राय बनाते हैं कि अरे आप तो पहले प्लेसिबो हैं, वो इसलिए बनाते हैं कि हम उनके टर्म एंड कंडीशन पर जाकर काम कर रहे हैं। तो मैं एक हम्बल रिक्वेस्ट करूंगा, मुझे बहुत अच्छा लगा DIH का नाम सुनकर कि हम ड्रीमर भी हैं और इन्वेस्टिगेटर्स भी हैं। तो हम लोग मिलकर एक सवाल जरूर खड़ा करें, एक आवाज जरूर उठाएं कि हमारी अपनी रिसर्च मेथोडोलॉजी होगी, और हम अपनी रिसर्च मेथोडोलॉजी से रिसर्च करेंगे और फिर हम उनको बताएंगे कि हम क्या रिजल्ट दे सकते हैं। बहुत बहुत धन्यवाद आपका, खास करके आपने मुझे बुलाया। हम आपको पूरा कोविड प्रेजेंटेशन कभी और किसी सेमिनार में जरूर देंगे। मैं समझता हूं कि ये ठीक नहीं होगा कि मैं ज्यादा बोलूं, क्योंकि वक्त नहीं है, जूम पर हमारे पास लिमिटेशन है। आपका बहुत बहुत शुक्रिया, DIH टीम का बहुत बहुत शुक्रिया, हमारे सभी होम्योपैथिक दोस्तों का बहुत बहुत शुक्रिया। डॉक्टर अदिति 2-3 स्लाइड्स आपको दिखाएंगी, उनको भी मैंने कहा है 2-3 मिनट में अपनी बात खत्म करेंगी। थैंक यू वेरी मच।
इससे पहले कि हम आपको ऑनर करें, मैं आपको बताना चाह रही हूँ कि डॉक्टर दीवाना हरिचंद के साथ मिलकर डॉक्टर दीवाना हरिचंद ने टीम बनाई थी, उससे मैं भी थी। उसमें हमने डिवाइस करे थे प्रोटोकॉल फॉर होम्योपैथिक रिसर्च, he had much influence on official and everything. We were working on it, but he went too soon. मतलब उसी बीच में चला गया, तो उनके बाद उसको carry forward करने वाला कोई और official हमें इतना influential person कोई मिला नहीं. But we were devising. वो question मेरे पास है, जो protocol हम बना रहे थे. We will work.
हम लोग करेंगे.
We will definitely do it.
Yeah.
So sir, आपको भी हमें भी virtually ये certificate honor कर रहे हैं. जितना काम हम सब ने करा है, certificate शायद उसके आगे कुछ नहीं है. जितना काम आपने करा है, डॉक्टर पाटिल ने करा है, डॉक्टर सदत ने करा है, certificate उसका सामने कुछ भी नहीं है. मगर ये हमारी humble duty बनती है. ये हमारी humble duty बनती है कि हम उन सबको honor करें जिन्होंने इतना काम किया है. So virtually this is here for you and we'll do it physically later.
Thank you DIH and thank you whole team. बहुत बहुत शुक्रिया, बहुत बहुत धन्यवाद.
Thank you, Dr.
Thank you, Dr. Arun. Thank you for joining us. Introducing Dr. Arun's beloved daughter, Dr. Aditi, BHMS, MCAH from the Other Songs Academy, Mumbai, homeopathic physician and nutritionist practicing in Delhi. STSH awardee 2016 from PCRH, Ministry of Ayush. Over to you, Dr. Aditi. Please share your experience with us. You're sitting at a wonderful location filled with your background with all the Schwabe and homeopathic medicines. Over to you, ma'am.
That's my father's death, by the way. Thank you so much, ma'am. And good evening to all the listeners. I'm extending my gratitude to all the members of DIH for giving me this opportunity to be the part of your family. And without wasting much time, I would just like to give you a brief overview of the work done by Dr. Arun and his team. So I'll be starting my screen sharing. Just allow me a minute. Yeah, so is my screen visible?
Yes, ma'am, it is.
Okay. So since past 2 years, the entire associate and fellow doctors in our clinic.
Interrupt you, doctor, just to interrupt you, your voice is echoing. It is quite possible that you have logged in from 2 portals in the same.
Just a minute.
Please mute the other portal. Thank you.
Yeah. So since past 2 years, we are working as a public health warrior. And I would like to just show you that how we all started. So in 2020, when the COVID came, which was just a SARS-CoV virus, which we were studying, and it was in the 2 lines of our preventive medicine book, and suddenly it chose to be to create the havoc in the world. So initially, what happened in 2020, the Dr. Arun prepared a team of doctors, and what we observed when the COVID came, that all the people, like what the modern diagnosis and the symptomology was seen, it was showing that few general symptoms we took. As you can see in the rubric chart, these were the few common physical generals which were told and were informed through the patients to the doctors, and we collected all these rubrics and we concluded that camphora was something which was outstanding. And then later, when we got a chance to interact with few COVID patients way back in the first wave, we found out that few mental generals were also, coming forward on the surface, which was as follows: like anxiety of mind, fear of disease was very much prominent as nobody was aware of this virus. Fear of being left alone because majority of the patients were being isolated without providing any good treatment. Fear of isolation was prominent. And then forsaken feeling. All these symptoms were prominent. And once we repertorize these physical generals and the mental generals, we found out that camphora was acting as a genus epidemicus for our observation. I don't know about the others. So, and as we had discussion with Dr. Sankaran in Mumbai and few other doctors in abroad. So this observation came to the surface that camphora was coming up and was acting as a prophylactic. So Dr. Arun decided to start a small cluster trial in one of the containment zones in Delhi. And we prepared a small team of doctors and we distributed camphora in 1,000 potency to more than 10,000 families. And we recorded their data for the next 6 months. And to our observation, which was of no surprise, approx 1 to 2% of them only got COVID positive. Rest, and also they were having comorbidities, and rest all the patients and the general public was free from the virus, especially in those containment zones. So we conducted studies in areas like Nihalwar, Tilaknagar, and Shalimar Bagh. These were small cluster groups that we conducted on our own level with the help of HEAL, which is an organization self-governing. And since, as you can see, that this is a very initial data I am sharing. The list is huge, and since then the data is being piling up. So as you can see, since May, we started from 17th May 2020, and till 22nd May, we distributed to approx 6,000 people in the Nihalwar zone, and we took a regular follow-up with them to see if any new symptom or something was coming up on the surface or not. Then similarly, we distributed in the next lot, we distributed the camphora as a prophylactic in Tilaknagar area from 10th June to 25th June. And then for next 6 months, we also took a follow-up. So here we distributed the medicine to approx 30,000 people, and the list is so on. So what we observed was that majority of the people who were given this medicine were showing less or no signs. Even if they were getting COVID, they were very mild symptoms way back in wave 1, which was very fatal. So this was this observation, and we collected the data, we repertorized everything, and the study was concluded, and we further, I would say we further took this forward to the governing authorities, to the Delhi government, with our work to establish and give us the authority, as Dr. Arun said, that he tried his level best to get through this, to get the permission so that we can actually practice homeopathy in COVID patients freely. And that's it. So the conclusion of the study and the experience was that we, as I already said, that in around 70 positive cases, then initially what we witnessed, that camphora was helping much in the prevention and the cure in the initial stage. And we suggested the authorities, government authorities, to distribute camphora as a preventive, especially in the containment zones of Delhi. And also one observation that in second wave, also camphora 1N acted well as a prophylactic. Obviously, after proper case taking and on individualization, the indicated remedy was prescribed to the individual patients who were suffering from various comorbidities. So here we concluded that yes, homeopathy has a vital role, and those who were treated at home with homeopathy were showing less to no signs of secondary infections like deadly mucormycosis. So this was our achievement, and that's it. I would like to conclude that this is a general conclusion that what homeopathy is. Homeopathy has proved its efficacy in controlling epidemics and curing many chronic diseases since Hahnemann time. And we must use this knowledge to the betterment of the people. That's all I would like to say. And I would like to thank Dr. Anupam ma'am for giving me this opportunity. And special mention, as I can see, Dr. Ruchi Singh ma'am is also in the team. She has played a major role in as my guiding angel since my college days. So I would like to mention her as well. So a big thank you to everyone. And I would like to extend my acknowledgement to Dr. R.K. Manchanda, Dr. Rajan Sankaran, Dr. Naveen Pavaskar, and Shalini Mishra, who have worked with us. And thank you so much.
थैंक यू डॉक्टर दीदी, इतनी यंग एज में आपने इतनी अच्छी अचीवमेंट करी है, आपने इतना काम करा है. रियली हैट्स ऑफ टू यू, एंड रियली ब्लेसिंग्स ऑफ योर फादर एंड हार्ड वर्क योर फादर एंड गाइडेंस फ्रॉम हिम definitely behind it. So we confer this virtual certificate to you, Dr. Didi, for your work. Keep this work going on. जितना आप अभी छोटी एज में हो, आगे तक चलते चलते आप ये काम करते रहो. ये हमारी आपके लिए दुआ है, आपके लिए प्यार है हमारा.
With blessings of you, ma'am. Definitely. You all are inspirations and guiding lights. That's it.
Virtually, I'm giving you certificate now.
Thank
and
you,
physically later. So now this is the time for question and answer session, but I don't think there is any question. Dr. Poonam, आप सामने आए, देखें कोई question answers है तो आप पूछ लीजिए. हालांकि जितना भी इन्होंने समझाया बहुत कुछ, it was very crystal clear. But still, if there is any question, Dr. Poonam, please ask.
Sorry.
Dr. Poonam hai? Dr. Poonam? I think she disconnected. Is she there, Dr. Arvinder?
You hear me?
Okay. Yes.
Can you hear me?
Yes, yes, yes.
Please switch on your camera also, ma'am. We can hear you. Thank you.
Go on, Dr. Poonam, please.
Thank you, everybody. Thank you, Dr. Patil, Dr. Arun, Dr. Aditi, and everybody else. There is no question, ma'am, but the presentations and the honor, it was well done. Everybody spoke very well. The presentation of Dr. Sadath was very well. I really appreciate everybody for attending it very nicely and having patience till now. It was, we still don't want to close it. मैम आप बोलिए कुछ डॉक्टर
ठीक है, थैंक यू डॉक्टर पूनम. आज क्वेश्चन आंसर्स नहीं, आपका पार्ट यहाँ पे खत्म हो जाता है. आई एम सॉरी, पर ये थैंक्स टू स्पीकर्स है जो इतना अच्छा बोले कि किसी को डाउट ही नहीं है, इतना अच्छा बोले कि डाउट ही नहीं रहा. डॉक्टर अरविंदर, आप प्लीज समाप्त कर देंगे जल्दी से.
हाँ जी मैम, श्योर. Thank you everybody for joining us for so long. It has been a long session. So summing up Dr. Sadath's session, thank you so much sir for sharing the structure. मुझे भी तक structure नहीं पता था honestly. Let me be blunt about it. Symptoms वैसे हम सबको ही पता थे, even students को भी पता होंगे और अखबार पढ़ के दुनिया को तो बहुत ज़्यादा पता थे. Kerala model of treatment that you shared, it was very interesting, and the most interesting part was that you were giving prescriptions on the basis of reports in x-rays, in scans, in blood reports, be it LFT, D-dimer. Of course, D-dimer is a new name for most of us. Ferritin levels, serum levels, CT scans. We wanted to ask you certain questions, but you have explained everything so well, be it the CBC report or ESR or X-ray scans. You shared your cases of Mariam, 70, Abdul, 2 years, and Rahmat, 91, if I'm not wrong. And most of them had comorbids, and you treated them with homeopathy without any side effects and helped them coming out from symptoms, whether less or more. I hope it is a very hopeful session for all the students over here. We have many students on our panel today, joined us over here as delegates. Thank you so much, Sadath sir. Thank you everybody for joining in. Over to Dr. Parul Mahajan. Dr. Parul Loomba, please come over and take.
Good evening, all. Good evening, Dr. Sadath. On behalf of Dreams family, please accept our sincere appreciation for the outstanding session. It was very interesting to hear about your experiences. Thank you so much for taking time from your busy schedule to be guest speaker. We look forward to learn more from you. Once again, thank you so much, sir. Our gratitude to all the respected awardees for their selfless contribution towards society and humanity. Thank you, Captain Manoj Loomba, Mrs. Suvidha Chaudhary, Mrs. Lovely Gupta, Dr. Jaswant Patel, Dr. A.K. Arun, Dr. Shashi Garg, Dr. Rinkush Buddhi Raja, Dr. Aditi Arun. Heartfelt thanks to Preeti Ji and Jansi for connecting with us. I would like to extend our vote of thanks to our sponsor, Edwin Biotech Private Limited, for their support and help in providing COVID medicines across India. Thank you to our participants. It's been a pleasure being with you all today. Thank you to our team members for their brilliant work and support. Thank you, everyone.
Thank you, Dr. Parul. And before we wind up and say goodbye, I want to tell you the future plans of Dreams and DIH. The first and foremost thing is membership. We are open for membership and we welcome you all. Google Forms पे आपके साथ फॉर्म्स शेयर करती जाएंगे. जो भी होम्योपैथी के लिए कुछ करना चाहता है, anything want to do for homeopathy, learn homeopathy and be connected with homeopathy, they can join us with the policy of no politics, no criticism, embrace all. We all welcome you. And poster competition आज किया था, लेकिन इतना टाइम नहीं था कि हम उसके रिजल्ट्स आज डिक्लेयर करें. नेक्स्ट सेशन में, नेक्स्ट मंथ में हम उसके रिजल्ट्स डिक्लेयर करेंगे. पोस्टर सेशन में काफी एंट्रीज आई हैं और नेक्स्ट सेशन हमारा ड्रग एडिक्शन पे होने वाला है. सो फिलहाल के लिए आप सबको नमस्कार, शब्बा खैर, बाय बाय, हस्ता ला विस्ता, हस्ता मनाना, फिर मिलेंगे.